Welcome to Calvert, a Connected Community. I am Wilson Perrin, a lay minister at Mount Olive United Methodist Church, a longtime resident of Calvert County and a former county commissioner, and I will be moderating the program today. This session is one of the three in a series that we've had so far. It's part of the community access program we have for Calvert County. And this program is sponsored by Mount Olive United Methodist Church here in Prince Frederick, where Reverend Dr. Dana M. Jones is pastor. Our goal is to continue to strengthen our local community and to bridge the gap between the faith-based community and the community at large, while emphasizing the common bond that connects us. I'm excited about our topic today. It's mental health, challenges in the connected community. And while mental health has always been with us, during the pandemic, this has become more of a challenge for society, for our country, our state, and clearly here in Calvert County. I'm excited about the panel we have assembled today to give us a better understanding of mental health and the many areas it touches. Let's meet our panelists. First of all, thank you for agreeing to participate on this panel. We appreciate the skills and experiences that you bring to the table. To my right is Tiffany McFarland. She's a licensed clinical professional counselor, and she's the mental health coordinator for Calvert County Public Schools. Followed by, to my left, Lisa Hartwell, registered nurse at Calvert Health, and she's the coordinator for the partial hospitalization program. And to her left is Andrea McDonald Finglin. She is a licensed clinical social worker and the director of the Calvert County Local Behavioral Health Authority at the Calvert County Health Department. That's a mouthful.
Yeah.
So to get started, each panelist will respond to a question. Subsequently, other panelists can chime in and comment on each of these questions. We do have several questions that we want to go through. And full disclosure, we are not here to solve this problem. This first step is to make sure that there is an awareness of what services are available and what we're doing in Calvert County to address mental illness. As we look at mental illness, I'm a lay person, so I'm not one of the professionals like you guys who this is your job, you do this every day. So I hear the term mental illness, mental health, and behavioral health. And it's, as a member of the community, it's a little bit confusing as to, are they the same thing? Are we talking about the same thing, or are these different things? Tiffany?
So they're different, but they all kind of encompass the same thing.
Okay.
So as you said, mental health. Mental health is about, mental wellness. So that can be emotional and psychological well-being in the brain. You also mentioned mental illness. So that is mental health conditions that can affect one's mood and behavior. And then you mentioned behavioral health, which, that is more so how your behaviors can impact your health, whether it be mental or physical.
Okay.
Absolutely. And within the behavioral health treatment community, the term behavioral health typically refers to both mental illness, substance use disorders, problem gambling, and other types of addictive disorders. And so it's this large field that's sort of encompassing a lot of what people struggle with when it comes to the brain. But with that, the brain and the body are so linked. Because when we talk about behavioral health and we talk about mental illness and substance use disorders, I also like to think about recovery, which is in some ways the goal for a lot of folks who struggle with these disorders. And that recovery, being so multifaceted, is being healthy in many dimensions of our lives. So in order to find recovery from behavioral health, you actually have to find recovery in lots of areas, including emotional, physical, occupational, financial, spiritual, that there's so many different dimensions of wellness and recovery, and they're all really important to pay attention to, and we're discussing mental health and behavioral
Okay.
health.
So, from my perspective in the hospital, in the behavioral health unit, we have an inpatient and an outpatient unit. The outpatient, where I am, the partial hospitalization, focuses on, managing the behavioral aspect of the mental illness. The staff coordinate to be able to help them develop coping strategies to help with their anxiety, with their depression. And the providers help with medication management, things like that. And then the resources, the social workers help with that. So the hospital kind of incorporates the mental illness, it manages it, but the behavioral health is what works towards stabilizing those behaviors so that they're able to continue in the community and go back to what they were doing.
Okay. Thank you. Describe the various mental health professionals and their relationship to treatment or level of care.
So we have therapists, and there are a lot of different types of therapists. So you have your licensed clinical social workers, you have your licensed clinical professional counselors, which is what I am, and they can all provide therapy. And, they can provide therapy in, outpatient setting, a school-based setting, a inpatient setting. There's also, with those therapists, they can be certified in certain types of therapy as well. You have your psychologists, which we also have school-based psychologists that do the testing and assessments. And then with a psychologist, they have a doctorate degree. School-based psychologists can also do counseling for the students too, and help out their school social worker and school counselors in the school. And then you also have your psychiatrists.
Okay.
We have psychiatrists and psychiatric nurse practitioners that can prescribe medication. And they are usually more so medication based, but they also do their own intake and own assessments in the field.
Lisa?
Hospital-based, I guess my focus is going to be mostly
Yes,
from the
that's good.
hospital-based, not community, as Tiffany and Andrea are. We have a psychiatrist or a attending physician that oversees both units. We have psychiatric providers, which are nurse practitioners who are certified in mental health. That's their specialty. Those medications and that type of behavior is their specialty. And we have counselors, mental health counselors that provide groups. There's a nurse who manages the medications, doing assessments, admissions, things like that. And we're just an intense group of people helping to stabilize.
Okay.
And across the continuum of care in Calvert County, there's actually quite a lot of different services that are available, from the hospital level, which is the most intensive level of service that you can get here within Calvert County, to outpatient services like what Tiffany was mentioning. And so that could be just once a week, once every other week, depending on your level of stability and level of need of services. And then between those two, there's just this vast continuum that includes different levels of substance use and mental health care, with different levels of intensity of services. There's also navigation services, so case management services to help people get connected to whatever services and benefits that they may need in order to be successful. There are supportive and rehabilitative services that assist people with regaining functioning after severe episodes of mental illness and substance use disorders. And so there really is a wide variety of services available in our community. I think one of the biggest challenges we're facing right now as workforce is that despite the number of services and the variety of services that are available, they're not always staffed at this time. I think that the behavioral health workforce, we've been experiencing the same workforce issues that many other types of fields have been experiencing as well. And so there are wait lists, in particular for youth and children to receive services at this time. And it's been a challenge that we've all really been racking our brains to try to solve and to face together.
You mentioned challenges in the area where you work. What are some of the major mental health concerns that you have seen in your workplace?
Oh, absolutely. So I've been in the field of behavioral health for about 10 to 15 years now. And I've worked across the continuum that I just mentioned. I've done outpatient therapy, outpatient substance use treatment. I have done inpatient or residential substance use treatment. I've worked in private practice. I've worked in outpatient mental health clinics. But along that continuum, a lot of what the biggest issues that I saw were trauma and abuse. Adverse childhood experiences, or ACEs, are a real issue we've been looking at them probably since the 80s, I think. Was the initial study on adverse childhood experiences that really taught us that when bad things happen to young children, that those things follow them and impact their physical health, their mental health, and their substance use, their future substance use, if there aren't also resiliency factors in place to help protect those youth and children. And that leads to co-occurring disorders with mental illness and substance use. So the majority of individuals with substance use disorders, I would say that the last time I saw a statistic on it was 85% of individuals with a substance use disorder have a history of trauma. And the more ACEs you have, the more likely you are to try and experiment with drugs, inject drugs, and engage in other sorts of risky and damaging behaviors. So really that throughout my career, those have been the real issues that I've grappled with, is the trauma and substance use, but that's also the field that I've worked in. So yeah. I'd love to hear other perspectives as well.
I will echo on the trauma. We don't keep statistics on the unit, but I will say that a heavy percentage of our patients, it all whittles down to trauma, that there was a traumatic event or a series of traumatic events in their life that was not dealt with, whether it's a death of a loved one or physical, verbal, sexual abuse that has occurred, that has just been kind of mulled over. Or not addressed because it wasn't reported, didn't seem that they were being honest, things like that end up having the child not being able to perform in school, to them avoiding school, it just escalates to the point where they become adults, and then the substance use and the self-medication to try and, self-medicate to handle the pain and to numb themselves. So, absolutely.
And I would like to echo on both of those, seeing as how I am in the school system. Not only with the staffing issue that you were talking about, Andrea, but also the trauma that both of you were talking about. So we are seeing, these students and these children coming in and just high anxiety, a lot of work avoidance, and we're trying to get to, the cause of, the issues and the behaviors that we're seeing in school. And there's a lot of staffing issues. We don't have enough social workers. We don't have enough school psychologists, school counselors. There's usually only one in every elementary school, and that's where you start seeing a lot of these behaviors that need to be helped. So the staffing issues, in the school for these students that are having these, issues with trauma, and they don't know who to turn to, and they don't know who to, talk to about it, is a major concern.
Okay. So after the pandemic, we're in a pandemic now, so it's not really after the pandemic. Health disparities among underserved groups became very apparent. And some of these challenges that you've been talking about, what inequities among patients or clients have you seen, and what ideas do you have to address those?
So at the LBHA, the Local Behavioral Health Authority, where I work, one of our strategic planning goals, so this is something that we focus on, is ensuring that everybody has equal access to behavioral health services that are there to meet their needs. So health equity is really intrinsic to the work that we do. It's paying attention to ensuring that everybody has services that are actually going to meet their needs. And so some of the questions that we constantly have to ask is, do we have providers that look like me? Or in the case of, you know, people who fall into minority populations, do they have providers that look like them? Do providers have the cultural expertise and knowledge to serve people who live within the community? Do providers speak the language of the individuals that they serve? Do they have access to interpretation services? And in particular, if we look within Calvert County, are there any deaf or hard of hearing providers that work here within the county? And as far as I'm not aware of any providers who are deaf or hard of hearing and can provide services, although we do have a lot of organizations that work with interpretation services and that's a wonderful access. It's a wonderful thing for people to have access to interpretation services. It's not exactly the same though as speaking the same language as the person who is providing your services, or you know, having somebody who actually utilizes American Sign Language. And so these are all questions that we have to keep asking ourselves. That Calvert County is predominantly, if we take a look at the demographics, where it's about a 50-50 split male-female. However, the majority of people in the behavioral health field that working in the field are female, are women, and so the majority of services are being provided by women. The majority of our service providers are white. That does match with the demographics. I believe Calvert County's population is about 85% white, but then the question is begged, is there a 15% provider match? And then are the people who are accessing services matching the actual demographics of our county? So I could talk data all day. I won't do it.
Yeah.
I'm not going to do it, but I could talk data all day. So we have to ask ourselves these really important questions: is our network of care equipped to provide services to the people who need them? And so we're always looking at this and ensuring that we bring training on how to serve African American youth, how to serve you know, the youth who are LGBTQ, and how to provide competent and culturally sensitive services to anybody who may be a Calvert County resident. It's really important to us. So
Some of the challenges.
So as you look at that, and you look at you mentioned before the resources that are not there, maybe because of funding, or perhaps because of not being able to hire that skill here in Calvert County, that even adds more to the challenge of the underserved getting
Absolutely.
the services they need.
absolutely.
Sorry, Lisa.
No, that's
Go.
fine. Sorry, I'm interrupted. Some of the challenges we face as the social workers on the unit, finding resources and their aftercare. Part of the, I guess, not requirement, but what we do in order to assure that they're continued to be safe, that they have aftercare, that they're not going to return to the hospital. We want it to be a comprehensive overview when they leave. They have a therapy session within a certain period of time, and they have a psychiatric provider. Finding someone who meets the needs of the child or of the adult, whether they're from PG County or Anne Arundel County, or even sometimes across the bridge from Salisbury area. Finding someone that suits them, that we think that would be a good fit, is very difficult. There's wait lists that we are challenged with. And then availability, you know, with the insurances, who will accept what. So it's a challenge within the unit to find that person that's going to fit them and hope that it's a good fit, so that they're able to continue with therapy and that they don't return to the hospital. So again, the continuum of care, to be able to provide the best source for them.
It's one of the issues that rural counties face, is that we're small. Like it's hard to do everything with so few people. So we're lucky in that we're close to some more densely populated areas, so we get to pull from their workforces sometimes. But it's just the nature of being in a small semi-rural area.
And the volume of clients we have and patients we have, it just doesn't end. There's no end in sight. It just, there's a continuous roll of patients that come in. So, you know, whether the health department has availability for child and adolescent right now, or whether, you know, they're in Charles County and what supports that they have there. So it's definitely a challenge.
Yep, that's what I was gonna say too, like working in the school system, you know, trying to work with the youth and the adolescents and finding them, you know, some care. Like I'm constantly sending parents and guardians like lists of local therapists and whatnot. Luckily, like a lot of people are now, after the pandemic, or well, during the pandemic, offering like telehealth services, especially for therapy, some psychiatric medications and things like that. However, you find it not as personable for a lot of the students. The guardians would like, the students to be able to go and sit down with somebody and actually have a conversation with them about what's going on, whereas like they don't have as much privacy in the home if they're doing telehealth and things like that. So it's been challenging for guardians to even be able to find the care that they want for their child in the county. And a lot of places outside of the county have wait lists.
Good segue into the next question. Do you know if Calvert County has been able to have access to developmental psychologists or pediatric psychiatrists for children?
So every single school has a school psychologist
Okay.
that can do testing, that can do assessments. Now, the schools share psychologists, though. Every single psychologist has different or multiple locations that they
Okay.
test at. Other than that, I believe the only developmental psychologist that can do testing in the area is Chesapeake Neurobehavioral Health, which is ran by Dr. Tamara Smoltz. So she does the testing and like biofeedback with the youth.
And she's located in Calvert County?
She's in Owings, yes.
Owens, okay.
Most of the time, otherwise, we're referring out to like Children's or Kennedy Krieger. Now, Kennedy Krieger did something with the schools and just actually Southern Maryland in general recently. It's called the ECHO model, where we could actually do case presentations and they would give us some feedback with their psychologists. So I know a couple of like the school social workers did some case presentations and got some, good resources and things that they could do with
Is that
their
using
cases.
video?
Yeah, that
Okay.
was all. It's an hour long each month usually, where we would be able to present a case, and obviously everything's like redacted, and
Yeah.
we don't use any names. But so some of the school psychologists and school social workers got some help there with like, oh, these challenging cases that they were like, I don't know where to go after this. As far as pediatric psychiatrists, we mostly have the nurse practitioners that I was speaking about in Calvert County, and they're great. The ones that I have worked with have been awesome. They sit down, they really get to know the child, do the assessments, and try and figure out what medication would be best for the child and the youth. We do have a handful of psychiatrists in Calvert County. I think all of them do see children. I know there's Dr. Soleil, he sees children. There is Dr.
Gergay?
Yes, Dr. Gergay, and I want to say he sees 5 and up. And then I know that there's a psychiatrist in Solomons, and I believe one in Huntingtown. So we do have
Okay.
a handful of psychiatrists. They do see youth, but I feel like mostly we have the psychiatric nurse practitioners prescribing medication. I know the health department has a lot of the psychiatric nurse practitioners, and they're all wonderful.
So when you say in the school system you have the psychologists, what role do they play? Do they help to diagnose a problem and then refer that child to a service outside of the school, or how does that work?
So to have the testing and assessments done with the school psychologist, you do have to like go through different like IEP things.
What's IEP?
IEP is individual educational
Yeah.
plans. So the parent or guardian would have to ask the school for testing,
Okay.
and then the school would be able to get like the certain forms out that they would have to do. And then the school psychologist, basically the mental health team and the administration at the school sit down, have a meeting, and see if testing is warranted. If it is warranted, then yes, the school psychologist can do the testing, they can do assessments, they can refer out. That's mostly for the school counselors or the school social workers to do, though, is refer out. And the school psychologist can help with the counseling in the school too. Not every school has a school social worker, unfortunately,
Okay.
because of the staffing issues. So the school psychologists do help with that sometimes.
Okay.
And just to tack on, so Calvert County is a health provider shortage area when it comes to psychiatric providers. So we don't have as many as we need. And then in particular, if we're looking at individuals who have medical assistance, the number of providers is even smaller. We have some providers that will accept private insurance, and then we also have providers that will only take private pay. So you actually have to pay out of pocket for every session. So it's a very limited pool, and then just depending on insurance type, it can really a lot of people end up having to go out of county for services.
And I will say, within Calvert County, we do now have the mobile crisis unit.
Okay.
I don't believe
Oh,
it
yeah.
is mobile at this time. Like, it doesn't really go out to and respond to calls like in the community, but you can go get an assessment done there. And they can actually get you into the health department pretty quickly for like an intake assessment or with a medication provider.
Now, is that under the health department?
Yeah, so
Okay.
the Calvert Crisis Response is one of the departments within the health department, and right now they have their urgent behavioral health walk-in center, which is on the lower level of the main health department on Solomon's Island Road, right outside the hospital. And you can walk in, it is open 24/7. And you can walk in and get an assessment and assist with any crisis de-escalation. They're working on integrating a mobile component, so more to be revealed when that
Okay.
resource becomes available again. But yeah, so it's open 24/7, and anybody can just walk in. Mental health, substance use crisis, problem gambling, domestic violence, any sort of behavioral health needs, you can just walk right in to the lower level of the health department and get help.
It's a great resource that came to the county.
Yeah.
Now, this is different from the support from a crisis unit that would go out with law enforcement, or is it the same unit?
They have responded with law enforcement
Okay.
or alongside law enforcement in the past. It's not a co-responder model, but if law enforcement clears a scene, a mobile crisis team is able to then go and respond if requested,
Okay.
when it's operating.
Okay. So right now, it's the mobile piece is not
The
operating.
mobile
but you
piece is
can
in the
walk
works.
Yeah.
Okay.
I heard, I don't know how true this is, maybe you could help me with it. I heard sometimes like the mobile piece can be there.
Yeah.
It just, again, depends on the
Yeah.
staffing.
Yeah. Resources. Next is, how accessible is treatment for drug addiction and mental illness for children, youth, and adults?
Well, and we talked about the workforce shortage to some degree, so I won't go too deeply into that. But so in Calvert County, we actually have multiple providers of most services. However, there are also some services that aren't available anywhere in the state of Maryland. So at this time, there is not a residential substance use provider for adolescents in the state of Maryland that is, at least not that accepts medical assistance. I don't even think there's one that accepts private insurance. There may be some private pays out there, but so there are some services that don't even exist in Maryland. We have a real shortage of residential treatment beds for youth throughout the state, and they're dwindling every year. There's less and less. We have no residential treatment placements for like long-term for individuals who are dually diagnosed with either mental health and developmental disability. There's some acute beds, but I don't believe we have any real long-term solutions for that population. However, we do have multiple providers here in Calvert County of both in-person and telehealth therapeutic services for adults and for youth. We have a number of PRP, which is psychiatric rehabilitation providers. So this is if therapy isn't enough and you need some sort of like in-home or within the community supplement to your therapy services. You can get PRP to sort of help you to meet your therapy goals in between your therapy appointments. And there are care coordination grants out there as well to assist people with getting connected to all of these different resources. So, and there's some peer support resources as well. And those are mostly grant funded as well, so there's no charge. Point Beyond down in Lusby is our local adolescent clubhouse that provides after school stability and structure to at-risk kids, and helps them to live recovery-oriented lives. And we also have On Our Own of Calvert, which is another great partner here that provides peer support to some of the most vulnerable individuals in Calvert County. They work really closely with our local homeless population and individuals who've been diagnosed with severe and persistent mental illness. So this is mental illness that lasts over a long period of time and has and it causes severe impairment in functioning. So basically ability to perform the daily tasks that most adults take for granted. So we have a lot of great resources, and it's just sometimes it can be difficult to navigate. So having the navigators like Maryland Coalition of Families or targeted case management through Cornerstone Southern Maryland, those are great resources for helping get connected to all the great resources, because it can be very overwhelming and confusing if you have someone who's really struggling, whether it be with mental illness, substance use disorder, or their child is really struggling. To then just like dump a bunch of brochures in their lap and say, here's all the services you should get connected to. The local care team at the Calvert County government, Arian Odom, that's also her entire mission is to get referrals for folks who are in need, for youth who are in need, and to help connect them to all of the resources that are here within the county. So it's just another resource that's available. So I would say that it can be accessible, but also really inaccessible. It can kind of vary. I mean, if I'm coming off the street and I've just found out that my child has a substance use disorder, there's so much for that child, but if I don't know where to start, it can be really tough. And so contacting the health department, the local behavioral health authority, contacting your pastor, who is hopefully connected to the health ministries so that they're aware of, all the different resources and services that are available around Calvert, can be a great first step to get connected.
One thing that they do in the schools too, the local behavioral health authority actually comes in the high schools and does like health fairs, usually during like the high schoolers' lunch, so they can kind of more so know about what is going on. And I actually sit on the local care team panel as well, so we meet monthly. Arian is great, and like Andrea said, like that is her job. So we meet monthly. We usually discuss about 5 students or so that are in need of, certain resources throughout the county, and she gets them connected to anything that is available for them. Parks and Rec services, adolescent clubhouse is there as well. So she tries to, connect them to these services that are available in the county, so the youth are getting, the help that they need.
Yeah. As we drill down, we plan to bring her in a session in this series, because yes, she was not available today, but we're gonna get her in.
Yeah, she's a great resource.
Yeah. Andre, you mentioned care coordination grants.
Yes.
Tell us a little bit more about that. Who can apply for them, or?
So the grants are already awarded.
Okay.
And the providers are out there. So Center for Children
Good.
actually has a care coordination grant in order to assist youth and their families with getting connected to resources, and then assisting those resources with communicating with each other. So one thing in behavioral health that is so essential is that the care team really works together, but it's also one of the things that's not reimbursed, and it's really hard to get everybody's schedules coordinated to do it. And so care coordination grants can be really essential, because then you do have one person whose job is to talk to all of the service providers and make sure that everybody's on the same page. So care coordination for youth in Calvert County is through the Center for Children, and they do have they have spots both for Medicaid, and they also have spots for individuals with private insurance. Okay. And that service is really just about making sure that people are connected to all the resources and having sort of a helping hand in getting people the help that they need.
Thank you.
There are also care coordination grants for adults. There are a lot of them, and they're all over the place. So, but it can't help or it can't hurt to contact the health department to find out about what sort of resources might be available.
And now, in your question, I believe that you also asked about adults, and there are
Yeah.
a lot more resources, especially for like drug addiction for adults in
Yes.
Calvert County.
Yeah.
Thank you. You wanna add
Just want to
anything?
add that the hospital, with its coordination with Shepherd Pratt, is working on easing the way to get admitted to the hospital. We are working on a direct admit process so that the avoidance of having to go through the emergency room and the detailed process of that, where the emergency room has its own issues, would be able to screen and get people in and treatment quicker,
okay.
on a quicker basis, so that some people don't want to go through having to change into a gown and have to go through that process. So this would be a way for providers to be able to directly send to us. So that's in process. I'm hoping maybe by the next panel we'll be able to have some sort of update on that.
Good.
Great,
Good.
Yeah.
especially in partnership with the
Oh,
local
yeah.
crisis services. If somebody needs to go back and forth between the crisis bed and the hospital, it'll really
Yes.
streamline things.
Yes.
Recently, suicide for youth has increased. What do you see that might have contributed to this increase?
I'll take that
Okay.
question. COVID really
COVID.
has impacted everyone. March 17th of, I guess it was 2020,
2020.
was when our program closed. We closed on a Friday, and then we got the call on Sunday. We were full at the time. We had 10 patients in the outpatient program. For the next 3 months until June 1st, when our unit opened, kids kind of floundered. They were left at home. They don't have any access to go see their friends, seek treatment, things like that. So with COVID and the isolation that everyone was impacted by, it has created increased depression, increased anxiety, avoidance of school, which is huge in the population that we see in our adolescents. We've worked on trying to transition the kids back with half days, where they go to school half days in the morning and then come back to us in the afternoon, because the profound impact of their anxiety prevents them from doing everything. Thinking about school causes them to go into a panic. So that slow transition back, just the decrease in socialization. Electronics, I'm going to say it, my kids would, have a fit with me saying it, and they say, no, it isn't. It is. The ability or the inability to now communicate back and forth as we're doing here. Some kids can't order off a menu when they go out. They won't go out. They won't eat because they can't ask for what they need. They don't have those, the skills to be able to ask that. So just that decrease in socialization, the isolation has increased, the mental health curve for these young individuals. And from that, with it not being treated, can lead to, the spiral of depression, spiral of anxiety. I can't put up with this anymore. And, suicide is the only option. It goes from zero to suicide. There's no steps that are taken. A lot of lack of critical thinking in the training with that. It's just, an impulsive decision, and sometimes it's impulsive. But it's just a lack of skill. And that's what we focus on mainly in the PHP, is providing those skills and giving them alternatives. But I would say the isolation from COVID is the biggest that we've seen an increase. I don't know.
Oh, I would absolutely agree that COVID and social media and electronics have really created an environment that's not conducive to the well-being of youth these days. Because again, if we think about lack of skills, but why is there that lack of skills is because youth and teens, their brains haven't finished developing, and the parts of their brains that are still developing are all the parts of critical thinking, problem solving, executive functioning, being able to focus and pay attention, being able to make good decisions. And so they have access to a profound amount of information, some of which is not good for them, a lot of which is actually not good or healthy for them. And, I think there's so many factors there. But that it's also the kids who are more at risk for anxiety and depression social media tends to have that impact on them, is to actually cause anxiety and depression. And there's a lot of emerging research into this. So I really do think that our kids are in a really stressful environment, both with COVID, with their access to technology, and that we're seeing that impact on their behavioral health, on their mental health, on their substance use. And they're just trying to cope. They're really just trying to do the best that they can in this really difficult world.
And like both of you have said, like in the schools, school went virtual whenever COVID started. So these kids, not only were they fully virtual, but they also had access to all these social media sites.
Yeah.
There was so much bullying going on over social media. That just wasn't healthy. And I mean, it was there before COVID, but it just got worse once COVID started. And then transitioning them back into school caused so much anxiety. These kids have been through a pandemic where their loved ones have passed away from this pandemic, and they're scared to go back into school, and they have this anxiety about going back into school because of the medical issues it can cause also for their loved ones and the things that they've seen. So in the schools, we've seen a lot of anxiety about coming back into the school, a lot of anxiety over bullying in the school, a lot of depression over those two things as well. And as the mental health coordinator, one of my roles is I get all of the risk assessments that come from every single school. So the risk assessment comes to me, I have to read it, sign off on it, and then it goes to one of the supervisors. And there is such an increase, especially in even pre-K and kindergarten kids saying these things about suicide, which then a talk has to be had of do you understand what that means exactly? But these are 4 and 5-year-olds that are talking about harming themselves, and it's not healthy.
There's a new 3-digit code now.
Yeah.
988, which if you dial will route callers to the National Suicide Prevention Lifeline. I think it's called the 988 Suicide and Crisis Lifeline.
Okay.
And it's now active across the entire country. So how does that 988 National Suicide Hotline work for someone here in Calvert County?
Absolutely. So 988, we were really lucky in Maryland that we sort of had infrastructure already in place to assist with our 988 rollout. So if anybody's familiar with 211, you might not be, but you might be. 988 is 211. However, 988 is going to be more consistent across at the national level. So you can go anywhere in the country and call 988 and you're supposed to get a call line. So we're still in really early implementation. So if you call 988 from Calvert County, it's going to depend on the area code of the phone that you're calling from. So it is not geo-linked like 911 now.
Okay.
That is ultimately the goal, is that at some point we're going to get there. But so you call 988, it's going to hook you up to the call center that is linked to your area code. Luckily, at least in Maryland, all of the call centers, there's I think 5 or 7 of them. There's quite a few regional call centers across Maryland that they will pick up, and they have all the same access to all the same resources. They're linked like that, so that if you call from Calvert, but you get the Hagerstown call center because that's where your area code is from, or whichever call center Hagerstown routes to, that they'll still have resources for you. Now, I don't know exactly what that means if you have, let's say, a California area code. Whereas California, they may actually have some call centers up and running, and you may get routed to them. Now, how much information they're going to have about Maryland resources, not 100% sure, but there are some states that don't have the infrastructure in place. So if you had, I don't want to call any states out because I'm not 100% sure where everybody is at. But if you had an area code from a state that doesn't have 988 infrastructure in place, I'm not sure what would happen. So it's very early on. But if you call 988, so sorry, let me talk it up now. So if you call 988 and you have a behavioral health concern, you can call just to talk. Like, it's a crisis hotline. If you just need somebody to talk to, there is somebody there to listen to you. You could also call and say, I'm having this issue. Where can I get help? And they will give you resources, and they will even give you the information. They'll give you a couple different places that you can search from. Now, let's say that the issue that you're having is pretty urgent and you need help now. They can actually give you information about a local mobile crisis team, if there is one available where you are, and can connect you to them, again, if that's a resource that's available. And they can talk to you about different crisis residential services. So you have crisis stabilization centers, which is short-term crisis stabilization, and then there's longer-term, like 1 to 2 weeks crisis stabilization that can be done. We have that locally here as well through Cornerstone, Southern Maryland. They have a residential crisis beds, so they can help you get linked to those services as well. So really, they're your behavioral health crisis catch-all. Is if you're in behavioral health crisis, the goal is that eventually we're going to steer away from calling 911 for a behavioral health crisis if someone is not in imminent danger. You should always call 911 if somebody's safety is at risk, if somebody's health or safety is at risk. But that for folks where that may not be the case, is that we can route behavioral health calls away from 911 so that public safety can deal with public safety, and that we can get behavioral health crisis services dealing with behavioral health crises. So we're really, it's a cultural shift. And the 988 it's not the starting place, but it's definitely a big step forward towards this shift of treating behavioral health crises as behavioral health concerns rather than public safety issues. And again, there is always a place for public safety in behavioral health, because there are times when somebody's life is in danger. They're a danger to themselves. They're, having thoughts of suicide. They're a danger to other people. They're making threats or, have a weapon. 911 should always be contacted if there is even a question about safety. But 988 will be there for folks who maybe just want connection to a resource rather than to have to end up EP'd at the hospital. I don't get go any further.
No,
Too
we-
far into
A lot of
that.
letters there.
Now, with you saying that, though, so if you call 988 and you say that you are, suicidal and going to hurt yourself or going to hurt somebody else, they are going to call the police.
Yeah.
Okay.
And so they'll call the police, and then the police usually come out, do a check on you, and if they deem it necessary, then they will emergency petition you to the hospital.
Okay. Now, Tiffany, you mentioned before the impact of COVID in the younger children. You mentioned age 5. So the next question relates to what has been the impact of the mental illness stigma on youth, and how do we combat that?
So honestly, I feel like the youth are opening up a lot more. They're talking a lot more about how they are feeling anxious, how they are feeling depressed. There are, they have groups and friends in school that they're like, oh, well, they feel the same way as me. They are going to their school counselors, their school psychologists, their school social workers, or their admin, and telling them, like, I feel like I want to hurt myself, or I'm feeling very sad today, and things like that. Most of the risk assessments on like the age 5 kids, that's more so them saying like impulsive things out of anger, or the anxiety of being at school because they've never had to be in that type of environment before. But I do feel like there is stigma around mental illness, which is unfortunate, just because mental illness is just like a physical illness to me and other professionals, whereas like if you're having a mental health issue and you need support, then we should just be able to get that support like you would for a physical illness as well. I feel like a lot of the stigma for our youth come from older generations that maybe had issues with stigma at that time. So there's a lot of issues around the stigma of medication for children especially, and I completely understand it. As a parent or guardian, you're concerned about your child's well-being whenever medication is said to be needed. Like, okay, well, how is this going to affect them long term? Like, you want to know a lot about it. So I do feel like there's a lot of stigma coming on the youth especially because of where their parents or guardians stand on certain things because of how they may have been impacted by mental illness before.
And one of the biggest combatants of stigma is information and knowledge. And so I think one thing that, we talked about the downside of the information highway, but one of the upsides is our kids have access to information about mental health and mental illness. They have information about substance use disorders and problem gambling. And so they're a lot more informed than, my kids know way more about all of this than I did when I was their age.
Yes.
And so the level of stigma is somewhat reduced because of that. But that, like I said, I just happen to be very well informed on the topic because it's the career path that I've chosen. And so, I am there and supportive, but not every parent has had the same education on mental health that the kids are getting these days. They get it in the school system, and the school system is so good about taking care of our kids' emotional needs to the best of their ability in their limited role. They're learning about it on the internet, and they're talking to each other about it, and because of all of that information, that there is at least the appearance of a reduction in stigma in younger generations. So really, with stigma, you mentioned medication, Tiffany, is that there's always been a really big stigma about medication, whether it be medications for mental illness or substance use disorders. And one thing that we, again, the more information that we get, the more studies that are done on these medications showing their efficacy, showing how the benefits versus the costs, there will always be side effects, but what's the cost benefit analysis, and being able to make really informed decisions with the experts who, know what they're talking about. So whether it be the nurse practitioner or the psychiatrist, whether it be the developmental psychologist and a treatment plan, determining that medication may be the right choice. It's the same type of conversation that you have to have with your doctor if you're diagnosed with diabetes or high blood pressure, is what is the best treatment regimen? Again, if we go back to recovery as a puzzle, recovery is a puzzle, and everybody's pieces are different. You have to go through and you got to try everything until you get the right fit of what recovery is going to look like for you. So medication could play a piece in that. One thing that people can be afraid of, they talk about addiction and medication. So I always like to be clear that there is a difference between a physical dependence and an addiction. An addiction is all about the behaviors associated with a physical dependence. So if you're physically dependent on a substance and it's causing you to steal from people, it's causing you to obsess about that substance, it's causing you to not pay your bills because you've spent all your money on that substance, it's causing you to miss out at work, that's an addiction. There are behaviors associated with the physical dependence on a substance. However, physical dependence in and of itself is not necessarily problematic. We have people who are physically dependent on certain medications, such as metformin or insulin for diabetes, such as statins for, I believe those are those cholesterol medicine? Yes, the nurse, thank you. And high blood pressure meds for folks who are at risk for, heart disease. That all of these individuals are physically dependent on their medications to live healthy lives. That doesn't mean that they're addicted to them. So if they're not going out and seeking these drugs outside, like more than what they're prescribed, if they aren't seeing, family and social issues related to taking their prescribed medications, that's just when it's physical dependence. So it's and that's a really clear distinction to make when we're talking about stigma associated with medications, is addiction versus dependence. And sometimes you can be physically dependent on a medication and it can save your life.
And another thing is, even as us professionals, doctors, things like that, we are always learning new things too. Like we have to go get, continuing education credits. Doctors have to go get continuing medical education credits and things like that. So as, the even higher professionals are learning new things in their area of expertise, they're teaching us. So we're going to these these trainings and learning, new things about the whole field of mental illness and how to kind of, combat the stigma that, people have around it.
Okay. So when we talk about youth and mental illness, clearly that brings in parents, grandparents, guardians. What role do you feel that they play in their child's mental health? One. And what are ways they can develop a healthy and meaningful dialogue with their children on mental health? And what is the best age to start those discussions?
I'll put my mother hat on now. I have 2 young children. They're here in Calvert County, and we started that discussion as soon as they could start having discussions.
Yeah.
I don't think there's any topic that's necessarily too young for kids. It's just about how it's presented, and so we've always had discussions about mental health, mental wellness, about we have discussions about drugs and substance use and addiction. I mean, they know what I do for a living, so I'm constantly having these conversations. And as a mother, I think the best thing I can do for my kids is to listen. And this is where being a social worker really comes in handy, is like non-judgmentally, because it's really hard when your kid comes to you and says, I've been thinking about smoking cigarettes, or I'm depressed. So let me not be condescending with my little kid's voice, but like I'm depressed and anxious, or sometimes I just want to die. That you just need to be there to listen without judgment, because if you freak out, they're not going to come back to you for anything ever again, right? So it's like sort of having that, like, just being there to listen and supporting them, and just like really acknowledge their feelings. I think that just validating a child's feelings goes so far to where they're like, you actually have respect for me. And if you treat with them with respect, I think that it goes a long way in getting that reciprocal respect. So I don't know. That's just in my journey as a mother of 2 kids who are neurodiverse. That's the best advice I can give.
Okay.
And as you asked, what role do they play?
Mhm.
The parents, the guardians, the grandparents, like, I think they play the biggest role. I also have 2, young children. My youngest isn't there yet. She's too young. But, my oldest, he's, getting to the point where, like, tantrums can, kind of come into play and things like that. And it's even just validating those, like, big feeling small problems at that point. Like, I understand that you're having these big feelings right now, but like it's okay that your shoe doesn't match exactly like the other one, that type of thing. So I do feel the same as Andrea, where like you should be having those conversations early on, like as soon as you kind of start seeing, oh well, they can, have a conversation like that, or they're having, a small meltdown. Like, you can validate their feelings in that.
Well, my discussions with my 3 children have kind of led my oldest daughter to go for her master's. She's now going for her licensed clinical professional social work degree. And my oldest son is now working on level 5 as a tech. So I think all those discussions about mental health have kind of trickled down to my kids. I did want to talk about the schools and their impact with supporting the kids with regards to stigma. Our unit has worked especially well with the schools in transitioning the kids back and making it a triangle, that it's us, the family, whether it's guardian, grandparent, whatever, and the schools as a continuous circle of information, that we are all there to support. And the schools have been extremely wonderful in accepting the kids back, knowing what they need. We have back to school meetings where the kid and the family has to go and discuss, how am I going to go back to school with all of this work? What work is just essential for me to be able to do? Because what we don't want to happen is the child to go back and say, I have all this work, oh my gosh, what am I supposed to do? The anxiety is all provoked all over again. So the schools work with what's essential based on what the child's needs are, the adolescent's needs are, what is going to work best for them. It's not that they expunge assignments, but they take into account what's going on. And that a straight A student, the first 3 semesters and the second semester or third semester, they start to decline, there's something going on. They're saying, what's going on? They're looking at it and seeing the big picture. So they have had a great impact on the success of the adolescents returning to school and being successful in school. And that's, I guess, the partnership that we have with them is to have the adolescents' needs priority, to be able to make it so that they are successful in whatever form, whether it's home hospital, whether it's half days, whatever they need. they've been extremely receptive to our needs and the child's needs and being able to work for that.
I think the last little tidbit I would give is that being a parent or a caregiver is tough. Please take care of yourself, because if you don't take care of yourself, it's harder to take care of your children, and then your kids also don't learn how to take care of themselves. And so, like, especially if you have a child with really high needs, it can be really stressful, it can be draining, and becoming burnt out is just, it's not a good situation for anybody. And so finding the support that you need in order to take care of yourself while you're helping to take care of your loved ones is really an essential element of how to best serve your kids.
And kind of this community has a lot of events too. Like, so you're mentioning grandparents. There's actually a community event at the library on April 29th called Parenting Again. And it is actually for grandparents that are parenting, you know, their children's children at that point too. You know, we have a lot of local events. It's just getting the information out there so you know, like, when they're going on, when to attend. Calvert County Public Schools is having a mental health resource fair at Calvert High School on May 2nd, which, you know, we have a lot of local vendors coming to talk about how they can help the children with their, you know, mental health and with their mental well-being. So, you know, just knowing your events and, you know, being able to access them and access the providers, I think would really help, you know, parents, grandparents, guardians in that journey too.
Now, for just the community, what can we do as a member of a community? Of course, we can talk about the workplace, we can talk about as we interact socially in the community. We probably see symptoms or signs of a need for help or mental health. So what can a member of the community do to maybe recognize that there is a role that they can play in helping someone get the treatment that they need?
Absolutely. I mean, so I would say educate yourself, do research, like find out like the real truth, because misinformation is out there as well. So like do your research, be there to listen. If somebody wants to talk or if somebody seems upset, reach out. It really can save lives. And and chalk the walk. So for Children's Mental Health Awareness Week, which I believe is it May, is it 5th or 7th?
8th, 7th.
May
It starts
7th
on the
through I
7th.
think the 12th. We are going to chalk the walk for Children's Mental Health Awareness Week. So this is in partnership with the Calvert County Family Network at the Calvert County government and the school system and the LBHA and a bunch of
Daycare
providers.
and-
The libraries are going to be doing it. So grab some chalk and share messages of hope, recovery, and wellness on sidewalks wherever you can for Children's Mental Health Awareness Week. And then if we come up with a hashtag, we'll be sure to let everybody know.
One of the things that we've done at Mount Olive, we've partnered with the health department and sponsored this class, mental health first aid, which I felt was a very good class. I would highly recommend that
Absolutely.
if anyone wanted to take that class.
There's one coming up in June, actually.
in September.
In
Okay.
September?
Good.
Yeah.
So it's very helpful for someone who, one, if you're not familiar with mental health, what are some of the symptoms or signs you see? And you can be very helpful when you recognize what's going on around you. Just a change in behavior of someone you've worked with for years, and all of a sudden there's a behavior change.
Absolutely.
You will learn how to handle that. So courses like that's very important. We have April Gray, our wellness committee chair at the church that works with the health department all the time. We have a health fair coming up later on this year, but that's been very helpful for us.
And with those courses, like there's actually two. There's mental health first aid and then there's youth mental health first aid too.
Okay.
And there's psychological first aid as well.
Wow.
So, yep.
Yep.
There
Where do I sign
are
up?
there are lots of training opportunities, lots of
Yes.
chances to get educated. The LBHA, we actually host a number of events. We've hosted the community conversations where we
Yes.
talk about medications
great.
and we talk about mental illness and substance use. We do a lot of de-stigma or anti-stigma events. So if you're interested, you can always check out our website for upcoming events.
And I did just want to tell everybody, so there's the Children's Mental Health Awareness Week where we're doing Chalk the Walk. There's also May is Children's Mental Health Awareness Month. So all of the schools are doing like little different activities for the kids.
Oh, okay.
I am sometimes at the Board of Education and sometimes at an elementary school, so I got to put together with my mental health team at the elementary school like some little activities to do with the kids for Mental Health Awareness Month, as well as Chalk the Walk throughout the school. And then like other schools are doing like other activities to just raise, you know, mental health awareness with the student population as well.
I think just to echo what she said about, you know, listening, recognizing changes in behavior is essential, whether it's a coworker, whether it's a family member, and just to check in. Somebody that you haven't heard from in a while, haven't seen you, you missed the last meeting, what's going on, being able to check in, listen, and then if you don't know what to do, call the health department, call the hospital. I field lots and lots of calls on our unit about what should I do, where should I go with this. Just being able to do that and helping support someone could save a life.
Yeah.
Absolutely.
There is a training called Safe Talk, and it is how to talk to people about suicide. And I really highly recommend it if you're interested in what to do if you become aware that somebody may be having thoughts of suicide. I really highly recommend Safe Talk. But one of the most important things that they teach in that class is that don't be afraid to use the word suicide, the words, you know, kill yourself, or, you know, are you thinking about killing yourself? Don't be afraid to talk about it. You will not put the idea in somebody's head. It either was already there or they're not thinking about it. And so really just don't be afraid to talk about it. Don't let stigma or fear get in the way. Like, ask people questions and be there to listen if they need support.
Yeah, I just want to, you mentioned the website. I've looked at the website, the Calvert Health, the health department, and also the Calvert County Public Schools. A lot of good information out there. So I would recommend, if you're looking for some information in what role that the health department, the school system, and the hospital play in mental health, that's a good resource that you can go to. So anything else as we come to a close that you want to say, or you feel that we've left out? This is a huge subject, so I know that we'll have at least part 2, maybe part 3 of this, so that people can learn more about and get an appreciation for mental health in bites that they can digest. So I see an opportunity going forward to get even deeper or in other areas. But before we do that, Lisa, PHP, partial hospitalization program, plays really an important part.
Yes, sir.
And if this is let's say in a non-mental health situation, and someone's in the hospital, you get out, the reentry is not that bad. You got your medicine with you, you
Right.
follow up. But if you've gone through a mental health crisis, just take
So,
a minute and tell us a little bit about the PHP.
The continuum of care, we've kind of talked about it a little bit. The most restrictive environment is the inpatient unit. Anywhere where someone is a danger to themselves or others, imminent danger, where acute crisis and stabilization is required to save someone. If they're, want to hurt someone else, they want to kill themselves, they want to hurt themselves. From that stage, it's a 3 to 5 day stay usually on our unit. From that, you can either go to the, back to work, which is sometimes disruptive because you've gone through this enormous crisis and it's kind of messed up your whole life. You've got medication, like you said. You need a bridge. The bridge is PHP. PHP is the next step in the continuum of care. Our program is a 5 to 10 day program, Monday through Friday. It's for adults and adolescents, separate rooms. It enables a person to be able to get the treatment and the support that they need, 6 hours of group therapy a day, and be able to work out the issues through talk therapy, through art therapy, through group therapy, the ability to manage their anxiety, learn about their anxiety, be able to talk about it, demonstrate activities to help reduce it, and then go home, practice, and come back. It's kind of like plan, do, check, act. If you're doing a quality, check kind of thing. It's let's talk about it, let's put a plan in place, go home and practice it, and come back. We have a extremely successful, knock on wood, program in which we do not get a lot of recidivism. We have patients who go out, recommend it to other people, and then they come back. My sister was here, my twin brother was here. It enables an individual to get the support that they need to slowly transition from that crisis back to the activities that were disruptive because of this crisis. So back to work, back to school. We have worked with kids back to school doing half days. I mentioned that before. Enable them, whatever was causing their crisis just didn't happen overnight. It's a buildup of a lot of behaviors and symptoms and activity that's occurred. It takes a little bit of time to unravel those types of things. So this program enables someone who is safe, who's no longer in imminent danger, to be able to come in during the day, get therapy, go home at night, and then return at a reasonable time back to their work so that they're stable, they're active, and they're participating again in what they were meant to do, whether it's school or work. So it's a great program.
And Lisa, with that, does the PHP program still do schoolwork with
Yes.
the adolescents?
Yes, we have a Calvert County public school teacher who's hired that comes in for 90 minutes a day so that the children can use their laptops to be able to access the school website, whether, I forget the website, the platform,
There's a couple
Schoology,
of them, yeah.
Schoology, that they're able to access and do assignments while they're in the program,
okay.
so they get full credit. They're excused, they have excused absence because they're in the program, but being able to continue working on their schoolwork makes them still a student, still has that aspect of what's going on in their life. So yeah, thank you for that, Tiffany, that's good.
Well, and I really like that you touched on the importance in recovery of patience, understanding, and like realizing that it's like a tiered model. It's not like all or nothing. Is that there's increasing and decreasing levels of support based upon what you currently need. And sometimes you need more support in order to remain stable. And there's no shame in needing more support, whether it be for mental illness or substance use disorders. But knowing that, again, there will be periods of high functioning, and then there may be periods where a child or a youth struggles more. And just understanding that that is part of the process. It may be an indicator that, a different support or more support is needed, but it's not an indication of failure on anybody's part. And so just realizing that, recovery is not a line. It's not a linear process, so that it bounces all over the place. So again, self-care being important because it can be a tough ride to be along for.
And with the partial hospitalization program, I can say that, I've talked to some of the youth and they love it. Like they're like, oh, it helped me, so much. It gave me these coping skills that I use, and, so it's a great program.
Fantastic. Okay. So any final words or anything before we close? Anyone?
Again, we are, Calvert County Public Schools is having that mental health fair with a lot of vendors coming out to talk about how they can help with, the students and youth mental well-being and, the programs that they have. The hospital will be there, the local behavioral health authority will be there, as well as 40 other vendors to come out. There's also door prizes, games that Parks and Rec is bringing. I think the local behavioral health authority is bringing games as well. Lucky Dog Ice is coming. We're giving away 200 snow cones for free at first and things like that. So it should be a, great event and a lot of resources and information. We're also having 7 different speakers, and one of the topics that somebody is talking on is self-care for parents, which Andrea was actually the one to suggest in one of the early meetings about the event. So somebody's going to be coming in and, talking to the parents about what you can do to help yourself whenever your child or your grandchild is in crisis.
Thank you. Any final?
I would say anybody who has questions about whether or not PHP is right for them or whether a family member needs inpatient, call the hospital's main number and ask for the psychiatric unit. Someone's always there to be able to answer it. PHP closes at 3. I return all the messages the same day I get them. Always ask. Just ask. Get the help you need. Don't hold back and wait.
I
Roger.
just want to say thank you for having me. It's been a pleasure.
Thank you. As we come to the close, I hope this session gave you some insight into what is before us in the area of mental health and the resources and services that are available to enhance Calvert, the connected community. I want to thank our panelists for taking the time out of your schedule today to really share some valuable information, and also to thank Pastor Dana Jones from Mount Olive United Methodist Church for sponsoring this session. This is, as I mentioned before, probably one of a series, because this is a subject that we can't cover in just one session. But it is a valuable and very important subject that we need to take the time to spend in doing it. I want to also thank the Calvert County government for supporting the Community Access Program. Calvert Broadcast is the multimedia broadcast arm of the Calvert County government's Communications and Media Relations Division. And the mission of Calvert Broadcast is to serve the citizens of Calvert County by providing programming and production resources that informs, educates, and promotes inclusion and community. So I thank the Calvert Broadcast team for working with us to put this session together. Thank you very much.